Hi, a very good morning to all. Today we are going to discuss this particular question. Doctors recommend that older people should get regular exercise, but many older people do not follow an exercise routine. Why does this happen, and what can be done to encourage them to exercise regularly? So we have a statement part here. The statement part is this one, that the doctors recommend that older people should get regular exercise. Even though they recommend many older people, they don't follow the exercise routine. So this is the situation. The situation is addressed in this part. And we have question number one. Why do you think this happened? And we be having one or two reasons there. And based on these things, you have to answer this question: what can be done to encourage them to exercise regularly? So your this question and this question has an indirect correct connection. Even though it doesn't appear to be directly connected, you have to say that it is indirectly connected. So both these questions are not separate. These questions are interrelated. So you have to integrate these two answers if possible. It's not always possible, but if you could do connect these two answers, if you answer the first question and if you answer the second question, and if you connect these two things in a proper way, then definitely you can get a better score. Now, I have got two particular questions. I have to answer these two questions in the introduction itself. So these two questions are answered here. There are two major reasons behind this, and it appears to be difficult task to motivate them to do the same. So this is the answer here. There are two major reasons. There may be many reasons. Two major reasons are there, and it appears to be a difficult task to motivate them to do the same. It's very difficult for us to motivate them to do the same. Now, what is this particular sentence? This particular sentence is the same thing. It is the first sentence rephrased. It's in another form. We have generalized the statement. It is a fact that many older people abstain from doing exercise. So this is a generalization. I have stated the statement part of the question indirectly, and then we have said, answered the two questions. Two major reasons are there, and it is difficult to motivate them to do the same. So we have to explain the thesis statement. We have to explain this particular sentences in the body paragraph. We have three body paragraphs. So in these three body paragraphs, we need to explain what we have said in the last part of the introduction. So that's what we are going to do. Turning to the first particular paragraph, the prime reason, you can say the prime reason. You have said two major reasons. Of the two major reasons, it's connected here. The prime reason behind this hesitancy is because of the feeble energy levels they have. The prime reason behind this hesitancy is because of the feeble means weak energy levels they have. This is the point. To be clearer, as a person gets older, his energy level reduces gradually, and as a result, he may not find interested in activities like exercise. You know that when a person is getting older and older, the energy levels will go down. And when the energy levels goes down, naturally, these people won't be getting uh, interested in activities, especially exercises. Now, this is what the thing. Even if they try to do the same, try to do some exercises which suits their age, they would not find a consistency. You are going ahead with this particular point regularly. So they won't be finding a consistency. It's because of this age-related problem. Okay, so I can say it's because of the I don't need these. Another reason. So the first reason, the prime reason. So this is something dealing with the cohesion and coherence. So major reasons, the prime reason, another reason. It's connected. Another reason. So when you see this paragraph, you can see this is explained here to be clearer. And this particular sentence is explained in the coming sentences. And this naturally, this particular sentence will be explained here in this paragraph. Another reason for this is that a considerable proportion of age suffer multiple ailments, and this acts as a hurdle on the way to do regular exercise. They suffer multiple ailments. To explain it further, when a person crosses his 60s, he might have one or the other lifestyle disease. Even if their doctors advise them to start a regular exercise regimen, many aged people fear the risk of injury. Now, we have a lot of health problems for the geriatric population. And when we have these health problems like diabetes, obesity, and all, the people will be at risk of injury. There may be risk of injury. You know that when it's difficult for an obese person to exercise properly, the same time you may have problems when you have diabetes mellitus. You may have higher chances of fainting when you do exercise. And if you have any cardiac problems, it is you may be at increased risk of doing certain types of exercise. So this is something risky. It's something which should be seen with utmost seriousness. So this is what we have explained. And the last particular point, this another point here. Lack of motivation is also seen as a problem for some of them. You know, we have seen point number 1, point number 2, and this is another thing. So it's not in the group. We have a subsidiary problem. Okay, so we have two major reasons behind this. These are the two major reasons. Along with these two major reasons, we have another particular thing, which I think it is seen among most of the people, is because of the lack of motivation. So we have mentioned that. We don't need to explain it because we have not said it as a main point. So we have completed what we have to say here, the causes. Now, it is to be admitted that it's hard for this old age population to adjust with regular exercise regime. Now, it's difficult for the old age people. You need to adjust, you need to admit the fact that it's difficult for these old age people to adjust with the regular exercise regime. Of course, this is mainly because of the aforementioned factors. However, when they are motivated properly by means of group involvements, the results would be positive, and that because of the aforementioned factors, we have mentioned two factors here. One is the age and one is the health of the individual. So because of these two factors, they are not able to follow the doctor's instructions, and because of these reasons, the old age population, it's difficult for them to make them motivated. So but we have to motivate them properly by means of group involvements. That you are not going to do exercise. How we can go exercise together, or your friend, so integrate into a social group if possible, so they can do exercise in groups. That would be better. Okay, so group involvements, the results would be positive. Setting up appropriate type of exercise. At the same time, we need to see some things else. The first thing is that appropriate type of exercise. Yeah, you have to go with appropriate type of exercise. And you need to see proper guidance. Someone should be there always, that there will be sometimes the risk of fall, risk of injury. So you have to give proper guidance. You have to motivate them properly. You need to involve them in groups. You need to set the appropriate type of exercise. That some people who are suffering from cardiac diseases have specific exercises to do. So we have different types of exercise designed for different people, especially in the case of old age people. So what we do is that we need to set this type of exercise. We need to give proper guidance for them, and we need to involve them in groups and motivate them to do exercise. This can fetch positive results. So this is what we can see. Now we have seen the reasons, number one, reason number two, and this recommended solution. It's actually not a solution, a suggestion, because it is difficult for us to solve the problem easily. Now to conclude, so what we have said in conclusion, to conclude, the primary reasons why the aged tend now to follow their doctor's recommendation to do regular exercise is because of their age and health. So this thing, age, health, it's summarized here. Even though it is hard to address this, a systematic and emotionally positive approach, we have said this thing, can bring out good results. So we have summarized all the three paragraphs. We have integrated these things into the conclusion. So everything is interconnected. From the very beginning till the end, we can see a link between the sentences, a link between the ideas. When the examiner reads this particular essay, he might understand that it's well connected. So it is appropriate. So, that the question is addressed properly, the task response is good, and we have well-connected words and sentences and paragraph, cohesion and coherence is good. We have used standard vocabulary, the lexical resource is fine, and the grammar is appropriate. You have got a good range of grammatical things, and you have got the accurate grammar almost. Thank you. And that is the end of this particular session.